Welcome to this Respiratory Catalyst podcast. I'm Jenni Quint, and I'm a Professor of Respiratory Epidemiology based at Imperial College in London and the Associate Director of the Respiratory Data Science Catalyst. This is a unique partnership that's funded by Asthma and Lung UK and delivered by Health Data Research UK, and our overarching mission is to try and encourage and improve the use of respiratory data in innovative research. In our Respiratory Catalyst podcast series, we're talking to data providers to give a unique insight into how to access their health data and why their data is important in answering respiratory research questions. If you haven't used health data in your research before and are unsure where to start, this podcast will help you understand what is needed to access it. For today's episode, it's my pleasure to be speaking with Susan Hodgson from CPRD. Welcome, Susan.
Thank you, Jenni.
So why would I want to use CPRD data to undertake research?
Well, great question. So the Clinical Practice Research Datalink, or CPRD, is a real-world research service. We collect anonymised patient data from a network of general practices across the UK. These GPs supply the primary care data, which we can then link to other health-related data to provide a longitudinal representative UK population health data set. About 1 in 3 GPs contribute to CPRD, so we've got about 18 million currently registered patients represented in the data sets. CPRD is really well established in one guise or another. We've been operating for more than 35 years, and we've got a really strong researcher community who've collectively published more than 3,500 peer-reviewed papers using the CPRD data. So if you want a quality assured, regulatory grade, longitudinal and representative health population data set for epidemiological or pharmacoepi research, CPRD may well be the resource for you.
Thanks, Susan. What types of respiratory questions could I ask using CPRD data?
So lots, and I had a quick look around in our bibliography. There are more than 400 papers relating to respiratory research. So the CPRD data clearly has utility in answering respiratory questions. The CPRD data contain the coded data from a GP consultation. So would be suitable for questions relating to respiratory disease epidemiology or health services delivery, healthcare resource use. The CPRD data also contain information on drugs and medications and devices administered in primary care. So can be used then for respiratory drug safety, drug utilisation, drug effectiveness studies, as well as pharmacoepidemiology and health economics studies. And the data have also been used for methodological research. We can also support offering services like providing online verification of electronic health records or CPRD Prove for studies that might require verification of the coded record for selected patients for observational studies where GPs would be involved in that to respond to a short questionnaire to validate what's in the GP record. So I think the CPRD data could be used to address a wide range of respiratory questions. And I think if the viability of a study in CPRD is unclear, we can also support with feasibility counts or feasibility study that you might want to undertake before running a full research study, for example.
Thanks, Susan. If I wanted to access CPRD data then to undertake respiratory research, and it sounds like lots of people have from what you've said, how would I go about doing that if I've never done anything like this before?
Sure. So CPRD needs to ensure its data are accessed only by bona fide research organisations conducting public health research. So researchers from an organisation that's not yet interacted with CPRD would probably first need to complete our new client review form that's available on our website. And we use the information in that form to determine the organisation's suitability to access the CPRD data. Researchers at approved organisations can then submit a research protocol that would be reviewed by the CPRD research data governance process, and that process ensures that investigators requesting access to the CPRD data for research purposes have viable plans. Those plans will maintain public and professional trust. We ensure that the research is of public health benefit, and that it's methodologically robust and suitable research question using the CPRD data. Once a research protocol is approved, depending on the organisation's licence terms and data requirements, there might then be a further contracting step. In terms of physically accessing the data, we're in the process of transitioning to our trusted research environment, which we're calling CPRD Safe. That's being developed in line with the 5 SAFEs framework, so that it allows approved researchers to access data in a secure and controlled way.
And if I've been enthused by today's podcast and I want to know a bit more about using and accessing the data, where can I go for more information?
So there's a wealth of information on our website, so that would be a really good starting point. So on our website, you'll find published data resource profiles, data specifications for the CPRD primary care data, but also our linked data, digital object identifiers, DOIs, and accompanying metadata for our most recent data snapshots. There's guidance on the website on how to draft your research protocol, information on the interventional and observational research services, and a searchable summary of all approved protocols and that extensive bibliography of those 3,000 plus published papers. So yeah, that resource, that bibliography of published papers is also a really great resource if researchers want to understand what research might be possible and what research has already been undertaken. If there isn't the information you need on the website, then of course you can get in touch with us via CPRD inquiries email, which is inquiries@cprd.com.
Amazing, thank you. Before we finish, anything else that you think people should know?
Well, yeah, I don't know if you wanted to talk about some of the examples of studies that have been used to answer respiratory questions.
Perfect.
I could provide a little snippet of information there so people can see the kind of studies that have already been undertaken. So yeah, starting with kind of, just disease epidemiology studies, there's been recent studies looking at up-to-date and accurate estimates for UK COPD prevalence, also epidemiology of childhood asthma in the UK. There have been very recent healthcare resource use studies, for example, looking at healthcare utilisation, again, amongst COPD patients. Also drug safety and drug utilization studies. So for instance, a recent study looking at the clinical safety of delayed antibiotic prescribing for upper respiratory tract infections. And yeah, in terms of pharmacoepi, recent studies looking at statin use in people with COPD and COPD exacerbation. So yeah, all of the range of studies have been undertaken, and I'm sure there's lots more that could be done using the CPRD data.
Thanks, Susan. What I love in your list of examples there is just the enormous breadth of things and questions that people can potentially answer all from the same data set. So thank you for sharing those examples with us.
No worries.
So that brings us to the end of today's episode of the Respiratory Catalyst podcast. Susan, thank you again so much for speaking with me and sharing some incredibly useful insights into CPRD and the use of CPRD data.
You're very welcome.
If you've enjoyed this episode of the Respiratory Catalyst podcast, please subscribe or get in touch with us, as we'd love to hear from you. Head to the podcast description for our email address and ways to stay updated. And thanks very much for joining us.